Welcome to Business Voice, a program of the Greece Regional Chamber of Commerce. Each month, we'll feature business and community leaders sharing their stories, initiatives, concerns, and passions. Learn practical information regarding community resources and opportunities. Now, the host of Business Voice, Greece Regional Chamber President and CEO, Sarah Lentini.
Hi, everybody. This is Sarah Lentini, and you're listening to Business Voice, a program of the Greece Regional Chamber of Commerce sponsored by Bartolomeo and Perotto Funeral Home. We're delighted to welcome you, and we've got wonderful guests for today's show, folks that are particularly great organizations in our community and that are playing pivotal roles as we all navigate through this COVID-19 landscape. So my first guest is from M&T Bank, which is playing a great financial role in supporting small business. Anis Osmic, who is the branch manager of the Greece branch of M&T Bank. Welcome, Anis.
Thank you, Sarah.
It's great to have you on the show. M&T is, of course, a great community bank, great community partner. We're lucky in this community. We have wonderful organizations, and we're also delighted that you're members of the chamber. And sometimes we think we know an organization because we see the name and the logo, and maybe we even interact with, or maybe we even have our account at a particular institution. But I'm guessing there are a few things that we could tell folks about the bank. So I'm wondering if you could start by just giving us a little bit of a sense of M&T Bank, a little bit of its history, where it does business, what kinds of services it offers.
Well, thank you, Sarah, for those kind words. M&T Bank is a regional bank that founded in 1856, so we've been around over 160 years.
Wow.
We have over 750 branches located along the East Coast. What we provide banking, insurance, investment, mortgage, and commercial financial services to communities that we live and work in. And I also want to point out who our customers are and what is our commitment to our community, if I may.
Oh, of course.
Our customers are the American doers, are the individuals, families, and businesses who are the backbone of our country. Our customers want the bank that works as hard as they do, values their time and money as they do, and believes in their responsibilities in their community as they do. And that's very important to us.
Which is terrific. And I know that, you make that evident in the ways in which you support things. The bank has been a terrific supporter of business and community, at least through the chamber. The Greece Regional Chamber of Commerce is really, very grateful to you for serving once again this year as the presenting sponsor of our 35th annual Community Awards, which is a pretty big deal. So thank you very, very much for what you do for us and for others.
No, thank you. I mean, that's amazing. 35 years, that's something that you guys should be proud of.
Oh, thank you.
If you may, I do want to just share with the listeners here our commitment. So we are committed to our communities we serve, and we do embrace diversity and believe in power of inclusion. We also believe that social justice isn't the responsibility of any of us in the bank, but also as a world, we are on a journey to make sure that we do our part to celebrate all the people and make up our communities. And we truly believe this day in and day out. And I just wanted to make sure that I share that. To your point earlier, we all know our local banks, as you see the logos and whatnot, but sometimes we kind of lose track of what the purpose is and what the values are.
Yeah, they're not. We may not know everything about a particular organization, even when we see it all the time. What great words, Anis. Thank you. They're inspiring and and eloquent, and they're particularly relevant today. It's a moment for. It's a moment for us to be our best selves. It's a moment for us to work together. It's a moment for us to, to be in as positive sense as possible, to be one community. So it's great to hear those words. Now, you're the branch manager of the Greece branch, correct?
Correct.
And how long have you been doing that, and how did you come to M&T?
I've been in financial industry a little over 10 years. I started in public accounting, moved into mortgage for international bank, and then moved into a retail bank. So I've been around as far as the M&T Bank close to 4 years. And my role at M&T Bank is very simple. It is really to promote the M&T values and purpose in our community through building relationships with small businesses and community leaders such as yourself and all the other not-for-profits that do a great job in my community.
That's great. So you know, the bank is a great fit for you, is what I'm hearing.
Oh, absolutely.
Yeah, that's wonderful. And how many years again?
Close to 4 years with M&T, and overall a little over 10 years in financial industry.
Oh, fantastic! That's great. And I know that you've played an important role in helping any number of businesses in our membership with major projects, be they businesses that are just getting off the ground or that are perhaps expanding or creating a new facility in the community. So that's great. Now, one of the things that you're doing right now that's pretty pivotal, I think you support, as you've said, small businesses in lots of ways already. But, there's been some funding that's been very specifically important and useful to business that's tied to the COVID-19 pandemic that I think you're involved with, correct? Absolutely.
It's Payroll Protection Program, as some of you guys know it as PPP. First,
everybody knows those initials, yes.
Absolutely. But, before I share what M&T did, first of all, I really want to say thank you to all the banks and all the not-for-profit organizations out there that participated and helped fund our local businesses with PPP. That really kept them moving forward. This was all about helping the community. And as far as the M&T Bank, we had a tremendous success, Sarah. To put it in perspective, we overall, in our footprint, we have total over 27,000 clients get approved.
Wow.
And totally more than $6.4 billion.
Wow.
And to put it even further perspective, that those companies collectively employ more than 600,000 workers. These numbers are just tremendous.
Wow. That's amazing. 600,000 workers.
Absolutely. So, and this is how we make a difference in people's lives. Like those 600 workers were able to, at some shape or form, keep their jobs.
Mm-hmm.
That's how we count our wins.
Mm-hmm.
And this is what we're all about.
Yeah. I really appreciate what you're saying on us. Also, that you're pointing out that this has been, a fabric, a collaborative, if you will, a coming together of lots of local, regional, and national financial institutions, banks, SBA lenders, along with organizations like the Chamber, trying to get out information about what's available, and of course, the state and federal government both playing a role in helping to communicate as well, but everybody trying to find some quick solutions to keep people employed, to keep businesses open. I know we've all had our, and we may even be continuing to have our debates about the relative merits of what's been rolled out. But I will tell you that I know that the PPP program has really been an important lifeline for lots of businesses. There may be a question about whether we need more than what's already been rolled out, but at the end of the day, that got moved through fairly fast, and that's a difficult thing to do in a big country such as ours. And thanks to SBA lenders such as yourselves, such as M&T Bank and others, lots of businesses have been able to stay open, at least in some measure, and to keep people on payroll. And we really do need to say that that's been a very, very positive thing. And I think at this point there's even more positive news, at least if I understood what I was reading earlier this morning. It looked as though there are going to be even even there's going to be even more flexibility with the PPP program, which I know many people were and we were part of that. We're asking for, and that's going to make the program that much more effective. So I thank you for bringing up the fact that it is a coming together of many players. But oh my gosh, 600,000 employees being impacted by the M&T effort by itself is amazing. Congratulations. And what a lot of work that must have been as well.
Yeah. Well, to put quickly in perspective, on the normal times, we do about 1,500 SBA loans, right?
Okay.
And we have about 25 employees covering this. During this period, we had to mobilize close to 2,000 M&T employees in order to deliver this and make sure nobody was left behind, because it was such a time sensitive. And to your point, I'm so glad that we got some great news out there for our businesses, that Senate passed changes to small business PPP loan program last night. So that's going to be a lot of great news for our businesses in our community.
Yeah, it's very great news, and there is still money available. There are still PPP funds available, correct? Correct.
Well,
so that's important too.
As M&T, we did stop taking applications a couple weeks ago, but there are still out there organizations that do still take applications. So I would definitely check in with your local organization and see if they can, if you didn't have a chance to take advantage of that.
Yeah. Well, that's terrific. Anis, congratulations on all your hard work and all the great impact that you've had over the years, but especially most recently, I know how hard you've worked to try to help small businesses through this very difficult time. We thank you once again for your presenting sponsorship for the 35th Annual Community Awards, which at this point we were supposed to hold in the spring. At this point has been rescheduled for the fall. October 15th is our rescheduled date. We're looking forward to celebrating with all of you from M&T Bank and the business community. And we thank you so much for coming on Business Voice.
Thank you, Sarah. Thank you for having me.
Well, you're very, very welcome. Anis Osmic, branch manager, Greece branch of M&T Bank. Anis Osmic, thank you again. And don't go away, everybody. We'll be right back with my next guest.
The loss of a loved one can be an overwhelming time of hectic activity and high emotion. Remembering and celebrating the lives of those who have passed is important and fulfilling. A meaningful farewell, focusing on their life story, can help with healing. Some families turn to the clergy at their church to capture the essence of a person's life. However, those who may not be connected with the church may worry there is no one to fulfill this important role. At Bartolomeo and Perotto, we believe that a life remembered lives on. One of our trained funeral celebrants can help you thoughtfully design and organize your loved one's treasured memories and ensure that the story of their life is not forgotten. Discover how you can create a meaningful farewell. Visit Bartolomeo.com or call us today at 585-720-6000.
Need help with health insurance? The Greece Regional Chamber provides assistance with health insurance for businesses, nonprofits, families, and individuals throughout our region. We pride ourselves on the personalized service that we provide for our clients. Let us help you find health insurance plans that fit your needs and navigate the paperwork. Greece Chamber Benefit Partners, located at 2402 Westridge Road in Rochester, New York, offers a broad range of medical insurance plans for businesses, nonprofits, individuals, and families throughout the greater Rochester Finger Lakes region, working with insurance companies including Excellus Blue Cross Blue Shield, Univera, and MVP Healthcare. We can also help you access insurance plans through the New York State of Health, the official health plan marketplace. Again, you do not need to live or work in Greece to utilize our brokerage services. We serve the greater Rochester Finger Lakes region of New York State. Visit greecechamber.org to sign up for one of our free health insurance information sessions or schedule an appointment with one of our licensed brokers. Call 585-227-7272. 585-227-7272.
RadiantHire Solutions is igniting growth in the Rochester and Buffalo areas for healthcare, manufacturing, legal firms, and industries, small and large. We are focused on sustaining critical hiring for essential team members and skills, or helping with a virtual interview process needed to navigate this time. We want to let you know we have services in place right now to help. If you have to go with less staff to do the most critical things during this uncertain time, do you have the right skill sets to sustain and grow? We know your services are extremely important and need to continue to be available to the community, and we are able to help you manage through the current situation. Virtual recruiting is something organizations are making a full transition over to. Do you have the tools and processes in place to be successful in a virtual recruiting world? We can help. We invite you to schedule a free virtual consultation with us. We also offer exclusive discounts and special consideration for Grease Chamber members. Give us a call. We'll be with you every step of the way. Visit RadiantHireSolutions.com or call 585-734-3905.
Since 1983, Herko Computers is Rochester's first and most experienced custom computer system builder. Herko Computers is proud to be working with many of our original customers, including the Greece Chamber of Commerce. Whether you need a custom business PC, gaming system, or network server, Herko Computers can build you a custom computer system that exceeds your expectations. Herko Computers also offers complete IT support for your business. We can configure your business network, provide security from viruses and ransomware to keep your business or medical office running the way it should be. Herko Computers is also a full-service provider of network wiring, Wi-Fi, and network camera systems. Need to upgrade from Windows 7? Give Herko Computers a call at 227-1270 to discuss your options to get your business upgraded to Windows 10. Herko Computers is proudly locally owned and operated since 1983. Call us at 227-1270 and schedule your Herko Computers free IT evaluation. Herko Computers, 227-1270.
Safeguarding your freedoms and your future. The WYSL stations.
Welcome back. I'm Sarah Lentini, and you're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Bartolomeo and Perotto Funeral Home. It's my great pleasure to welcome back to the show Dr. Stamatia Destounis, who is one of the forces to be reckoned with at Elizabeth Wende Breast Care, an organization that in some ways needs no introduction, but that nonetheless I'm going to ask her to talk about a little bit because we may all know just a rarefied slice of Elizabeth Wende Breast Care. And for starters, I know you've got more than one location, which people may not realize. But welcome to the show, Dr. Destounis.
Oh, thank you so much for having me back. Hello, everyone. Yeah, so I'm one of the radiologists at Elizabeth Wende Breast Care. And we're very excited because we actually have a Greece location that people may not know about. It's on the Greece Gates border, right off Long Pond Road between Spencerport Road and Ridgeway Avenue. It's at 3 Sheridan Place, Suite 200. So we've been there for a while, and, we offer our standard of care, which is the 3D mammograms. We've been doing that since 2011, since they became FDA approved. It's the better mammogram. But we also have additional services that we can offer our patients, such as screening ultrasound if the patient has done breast, and also DEXA, bone density examinations. And, we have offices. Our main facility is on Sawgrass Drive, and we do MRI there and obviously all the types of different needle biopsies if patients need. But we also have offices in Webster and Geneseo, Batavia. So we're, even the northern country, we're up in Carthage. So, Elizabeth Wende Breast Care has been around for a long time.
Yeah, and is in lots of places, more places than I realized. I knew you were in multiple places, but that's a longer list than I realized, so that's great to know. And Elizabeth Wende has been around a long time and has a fairly important history, correct, in terms of bringing the entire country's attention to the need for testing. Is that correct?
Yeah, so, Wendy Logan Young started the practice in 1975, and it was the first freestanding breast clinic to offer patients their results the same day after they had their mammogram. Wow. And, we have the radiologists, all of us are subspecialists, so we're all trained in breast imaging. We're all fellowship trained that now work there ever since, Wende retired years ago. Mm-hmm. And we've continued, that kind of thinking of the patient is first, and we certainly communicate with our patients, and if they have concerns, we see them and we talk to them. And when we do needle biopsy procedures, because we need to diagnose an area of concern that we may see on the mammogram or on ultrasound or that we see on MRI, we call the patients with the results. So we've continued that, that thinking, that forward thinking, that we are the clinician for the patient's breast. And we offer all the newest and greatest type of technology, whether it's the 3D mammogram, whether it's the screening ultrasound for women with dense breasts, whether it's the breast MRI for our high-risk patient or our newly diagnosed breast cancer patient. So we offer what is the newest out there. We research everything. We do our clinical research. We evaluate new technology, and if we think it's valid and valuable, then we bring it into our offices.
Wow.
And we utilize it at all the offices for our patients.
That is really impressive. I didn't realize that you were researching new technology all the time as well. I mean, it's a great thing for you to be doing, but that's a whole other endeavor, right?
Right. Yes, it does keep us busy.
I imagine.
Absolutely.
Yeah. And radiology is no easy job, is it? I mean, you really need to know what you're looking for, right?
Well, so radiology does encompass at the whole entire body. So radiology is, a very interesting field, and you definitely have to, understand anatomy and understand biology and lots of different things. And now most of us have become so subspecialized in different areas. So if you're coming to my office, one of my facilities, whether you come to the Victor office or the Greece office or the Batavia office or the main facility on Sawgrass, all I do is breast imaging. So you're not going to be getting a chest CT at the same facility or a bone X-ray. All we specialize in is the breast. And, for us, that keeps us very busy because there are so many different conditions, many of them benign, that affect the breast tissue, and we're well-versed and very familiar with them.
And how are we doing when it comes to getting the word out and having an impact on women so that they get tested early and impacting breast cancer and catching it early and keeping women alive? How are we doing?
So, we know that there's so much great technology out there. There's many tests that have been, researched and come out, and they may be helpful in a certain subset of the population. But screening mammography has been the test that has been around and tested in many large trials for many decades. And that's the only test that has been proven to reduce cancer deaths, breast cancer deaths. So what we need to get the word out and continue to do so through the healthcare providers that take care of the women, and through the, social media and informational websites and also face-to-face meetings with every patient, it's to educate them about the importance of screening, that you don't want to palpate something and then come in, because you're feeling something in your breast. You want to come in for that routine mammogram yearly so we have the opportunity to find it the smallest size. Yeah. Because since there's no cure for breast cancer currently, the smaller we find it, the better it is, and that ensures the best prognosis for the patient and minimal surgery and minimal type of treatment. And then we're around for a long, long time to take care of our families and keep working and do the things that we want to do, So a breast cancer diagnosis is certainly not a death sentence now. We're finding tiny things, especially with the tomosynthesis, the 3D mammography, very, very small things. But we do need to keep getting the word out that women have to come every year, and it's from 40 every year.
Age of 40.
Not 50 every few years. And don't stop at 75. My mom is 83 years old.
Oh, wow.
She runs circles around me. So, she is, a valuable member of our family and her community, and she's healthy. So if you're healthy, finding something small in your breast, whether you're 75 or 78 or 83, it's minimal surgery, outpatient, minimal treatment or no treatment, and then you can live another several years as women are living longer and longer. and you can live healthily, you know.
Yeah, live well as opposed to just live.
Exactly.
Yeah.
But now the thing with COVID and the pandemic has made many people, delay, postpone their screening. Or, maybe they're nervous to come in and have a screening examination. Or they're thinking, I'll do it next year. Let me just skip it this year. And because I don't want to go in, I'm nervous about, is everything clean? Is everything safe?
Mm-hmm.
People are nervous now.
We
have yet one more problem to think about.
And have you guys been functioning through, all this time? And are people able to come in and get screenings? How have you navigated the COVID landscape and helping your patients?
So the COVID landscape has been tough, so we did actually close for a short period of time in order to prepare all our offices for social distancing and recreate the waiting rooms and create workflows that work for the staff and the patients. So the staff had to be trained, and all the patients now do not wait in the waiting room. They come in, they have their mammogram. All our offices are open for screening or for diagnostics. If you have a concern or a problem, call our office and we will see you. But we're doing things a little differently because our first thought always is to our patients. So we have protocol changes. We're doing daily cleaning on, of all the areas, the common areas where the staff and the patients are. We obviously are sanitizing everything that's touched by the patients and the staff. We are scheduled appointments now that are further apart, so there are fewer people in any of the offices at any one time. And we disinfect and sanitize everything that the patient will touch. And no one's waiting in the building. We don't have any visitors that can come in anymore. If the patients live a long distance, they're given the opportunity to wait in their cars. And then we will call or text or email and with the results, so they don't have to leave to drive, a long distance and find out maybe we need to do another test or one more image or an ultrasound. So we have come up with ways to make sure that our patients are safe. All the EWBC staff is wearing masks. All the patients are required to wear masks while in the office. And, the other thing that we're doing is we're checking and we're pre-screening and screening every patient to make sure there are no COVID symptoms, because if there are, then we cannot see them. And all our staff is doing daily screening to make sure they don't have any symptoms.
So you really covered all the bases. That's fantastic. And sounds like you did that early on, so you've been able to continue to see people. And importantly, for folks that are listening, it sounds as though all of the Elizabeth Wende breast care facilities at all the locations that you mentioned are open for business. Is that correct?
Exactly.
Awesome.
Yes.
Yeah.
So the patients can call the main number, which is the 442-2190 number. And if they live near Greece, they can go and get their mammogram there. If they live near Victor or Batavia or Webster or Carthage, or Geneseo, they can go or the main facility, because we do have, patients that come to the main facility, so they can come to wherever they want, whatever's closer for them. Things will be a little different. So check-in is a little different. The arrival times are staggered. Our waiting room seating is spaced out. You will not see a lot of people around in the building, and the results are done a little differently. So you may be waiting in your car if you live a long distance, or you'll get a text or an email or a call from us saying everything is okay. You'll get your results as soon as we can, the same day, typically within a few hours of your appointment.
Yeah, which is so important, because it can be, a very anxiety-producing kind of a process, right? So,
Absolutely.
that speaks to health too. The less stress and anxiety you have to go through, especially, if you are sick, the less likely you're going to have a negative outcome. All those stressors are actually very bad for us. So that's wonderful that you do that. Yeah, it really is wonderful.
I hear you.
Yeah,
I know. So we're trying to make it as painless as possible, and we deep clean throughout the day all the exam rooms, all the waiting and common areas. We disinfect anything that's touched, by anyone, and everyone's wearing face masks.
That's
like
great.
I said, so we are doing serious cleaning to make sure everyone is safe.
Yeah, that's wonderful. So it's great to hear that people don't have to be putting off this service. I know there are other kinds of services that, at least a few months ago, or over the last couple of months, that people were not able to access. Right. And this one, it sounds like it's important for them to know that you've been available to them, and you continue to be, and that you've got all the best protocols in place, and there's really no excuse for not going to get your mammogram, which, as you said, you need to get from the beginning with the age of 40, correct?
Right, exactly. Age 40 and every year, and it just takes a few minutes, and, that's just peace of mind.
Yep.
And if there is something there, it can be identified as soon as possible, because really that is what is giving the best prognosis, is to find something tiny. It's easy to remove surgically. It's outpatient type of surgery.
Yep.
Patients don't have to go through lengthy, painful treatments, and it's just minimal type of treatment, and you're good to go.
Yep.
And so we are here to tell you, we're here to welcome the patients. Come in, don't delay your mammogram, and we're here for all the breast needs, so if any woman or man, because some men get breast cancer also.
Right.
So, but the reality is what we deal with every day is not breast cancer. It's a lot of benign things, but those are also very anxiety-provoking, right? Whether it's,
Yep.
a skin change, breast pain, a lump that may be a cyst, a fluid pocket, or a fibroadenoma. But those are all things that need to be evaluated also to make sure that they're okay. So we don't want women or men to sit at home and worry about things. Come in and get it evaluated.
Right. And it's pretty darn painless. It's pretty quick. It is something one shouldn't be putting off, and as you said, you've made the case very eloquently that it is, and very persuasively that it is. It will save if somebody does have something that's starting that needs to be taken care of. It saves going through a much worse ordeal if it's left to grow and not checked and not taken care of. So we thank you so much for what you and everybody else at Elizabeth Wende Breast Care do day in and day out in the community. And thank you especially all of you for continuing to provide services during this difficult time and figuring out how to protect yourselves as well as patients, which it sounds like you've done beautifully. And thank you so much for coming on the show again, Dr.
Oh, thank you for having me, and thank you for being there and providing information, for everyone to listen to and learn. And this is a wonderful program, and thank you for having me be part of it.
You're very, very welcome. Dr. Stamatia Destounis from Elizabeth Wende Breast Care, which has offices throughout the region, not just at Sawgrass, which is, of course, the mothership, but also in the town of Greece and many, many other places with all kinds of best technology that really is available. I didn't realize until today how much research you do to keep everything as modern and innovative as possible. So thank you again, Dr. Destounis, for coming on Business Voice.
Thank you so much.
All right, don't go away. We're going to be right back with my next guests, and it's a wonderful program. You don't want to miss them either. Don't flip that dial.
WYSL Avon Rochester.
The loss of a loved one can be an overwhelming time of hectic activity and high emotion. Remembering and celebrating the lives of those who have passed is important and fulfilling. A meaningful farewell, focusing on their life story, can help with healing. Some families turn to the clergy at their church to capture the essence of a person's life. However, those who may not be connected with the church may worry there is no one to fulfill this important role. At Bartolomeo and Perotto, we believe that a life remembered lives on. One of our trained funeral celebrants can help you thoughtfully design and organize your loved one's treasured memories and ensure that the story of their life is not forgotten. Discover how you can create a meaningful farewell. Visit Bartolomeo.com or call us today at 585-720-6000.
Since 1983, Herko Computers is Rochester's first and most experienced custom computer system builder. Herko Computers is proud to be working with many of our original customers, including the Greece Chamber of Commerce. Whether you need a custom business PC, gaming system, or network server, Herko Computers can build you a custom computer system that exceeds your expectations. Herko Computers also offers complete IT support for your business. We can configure your business network, provide security from viruses and ransomware to keep your business or medical office running the way it should be. Herko Computers is also a full-service provider of network wiring, Wi-Fi, and network camera systems. Need to upgrade from Windows 7? Give Herko Computers a call at 227-1270 to discuss your options to get your business upgraded to Windows 10. Herko Computers is proudly locally owned and operated since 1983. Call us at 227-1270 and schedule your Herko Computers free IT evaluation. Herko Computers, 227-1270.
RadiantHire Solutions is igniting growth in the Rochester and Buffalo areas for healthcare, manufacturing, legal firms, and industries, small and large. We are focused on sustaining critical hiring for essential team members and skills, or helping with a virtual interview process needed to navigate this time. We want to let you know we have services in place right now to help. If you have to go with less staff to do the most critical things during this uncertain time, do you have the right skill sets to sustain and grow? We know your services are extremely important and need to continue to be available to the community, and we are able to help you manage through the current situation. Virtual recruiting is something organizations are making a full transition over to. Do you have the tools and processes in place to be successful in a virtual recruiting world? We can help. We invite you to schedule a free virtual consultation with us. We also offer exclusive discounts and special consideration for Greece Chamber members. Give us a call. We'll be with you every step of the way. Visit RadiantHireSolutions.com or call 585-734-3905.
If you're looking to market and grow your business, make new business connections, and give back to the community in a meaningful way, consider joining the Greece Regional Chamber of Commerce. We're the largest suburban chamber in Monroe County, and we offer networking, education, marketing, insurance, and advocacy. You do not need to live or work in Greece to join. Our members come from throughout the region. In short, we're better together, and together, we're moving business forward. Visit greecechamber.org or call 585-227-7272 to join today.
More than 20,000 watts of truth. WYSL AM 1040, FM 92.1 and 95.5 West.
Welcome back. You're listening to Business Voice, a program of the Greece Regional Chamber of Commerce, sponsored by Bartolomeo and Perotto Funeral Home. I'm Sarah Lentini, President and CEO of the Chamber, and also your host. And it's my great pleasure to welcome my next guest, Dr. Ben Liu, who is Associate Professor of Clinical Radiation Oncology and Clinical Director of Radiation Oncology at the Greece campus of the Wilmot Cancer Center on Bellwood Drive in Greece. Welcome. So I really appreciate your joining us, Dr. Liu.
My pleasure, sir.
Thank you. Let's start with a little bit about the organization, the Wilmot Cancer Center, Wilmot Cancer Institute on Bellwood Drive in Greece. How long has it been around? And I think we can guess what you work on, but what makes it particularly unique in the landscape of the healthcare system here in Rochester? Certainly the fact that it's in Greece strikes me as a very good thing.
Right. The Wilmot Cancer Institute at Greece has been in the community. We have been serving the community for about 3 decades.
Wow.
Yes. So at the time, Interlix Oncology and us, about 30 years ago, come together to come here. We work as a team to start the cancer center that has been in the community, as I said, for about 30 years. So that's not a new to the community. But what is new is that we recently moved to a new location at the Bellwood Drive.
Yes, that's a very big deal. And before that, were you at the, am I correct, were you at the Unity campus?
Yes, well, our old office is very close to the Unity office. In the Unity campus, that's one of the POB buildings. We just moved out to a new facility that's about less than a mile from there.
Yeah, and Bellwood Drive, I think many people will recognize the name of that road because it's right by the entrance to the expressway, correct?
Right. It's very close to 390, very easy to access from all over places. You can see, if you don't know where it is, the BJ's stores. You can see from there.
Right. So that's great. I mean, that's exactly what you want when you're serving people, to be very accessible, from a main drag like a highway. So is the facility one? I mean, you're part of the U of R Medical Center, correct?
That's correct.
Yeah. So were you always part of the U of R Medical Center?
Yes, it has been for decades.
Oh, for the 3 decades. Okay.
Yes.
Is it a hub that's here in the Greece area? Does it relate to another part of the system? U of R Medical Center is sort of a large, complicated, by definition, kind of an institution.
Yes. Let me give you a little bit. So Wilmot Cancer Center, they started in the 1970s.
Okay.
So that's been the main cancer center in the Rochester region, and it's also a leading cancer center among the other cancer centers in the nation.
Yeah.
So we have the most advanced technologies, expertise, and also the clinical trials. We have over 100 trials in Wilmot Cancer Center for different type of cancers, though. But that's in the Strong Hospital. But in addition to this main campus in Strong, we have multiple cancer centers in the communities. So our idea is to try to bring our expertise, bring our technologies, state-of-the-art technologies to the community.
That's wonderful. Yeah. So this is the same Wilmot Cancer Center that's at Strong.
Yes.
It's just it's the Wilmot Cancer Center at Strong coming to the community.
Right. So we're all on the faculty of the URMC.
Got it.
That's and another thing that not only we serve the Greece community, so the other small towns nearby, the west part of the Great Rochester area, like North Chi-Lai, Spencerport, Brockport, Hilton, Hamlin, they are actually closer to here than other centers. So we draw a lot of patients from there, and we have been serving them for many years as well.
Oh, wow. How many people do you typically serve in, I don't know, a year or a week or whatever unit makes sense?
Each year we have over 300, close to 400 new patients.
Wow.
We have a couple thousand patients that we have treated, or many of them have been cured.
Oh, that's great.
Yeah.
That's great. That's wonderful, because there have been a lot of advances in the treatment of cancer, correct?
Absolutely. So in the last couple decades, so we definitely see the early investment, we can see the results. So we have longer survival. We have patients completely cancer-free after treatment.
Wow, that's great. That's really marvelous. That's really good news.
Yes.
And how long have you been with the center? It sounds like it's been a while.
I've been here 2007.
Oh, that is a while.
Yes.
Yeah. Wonderful. And is part of what attracted you to the center the fact that it's one of the leading cancer institutes in the country?
Yes, absolutely, yes.
Yeah. And was your background, did you start out knowing that you wanted to specialize in you're a physician, but did you start out knowing that you wanted to specialize in oncology?
Oh, I started very young. From my personal level, I lost my sister to cancer when I was like 9 or 10 years old.
I'm very sorry.
Yeah, the 70s, but there's not a whole lot of things you can do. But that's also the time we started the war against cancer. So I always want to be help to people. I want to be a cancer doctor from very young.
Oh, well, it's great. You know that what you're doing is meaningful, connects to you in a profound way. It's bound to make you a better physician. That's the sort of physician we all want. Somebody who is connected on more than just a technical level with seeking treatment, with seeking to help us get better. So when when you moved, is part of the challenge making sure that people know where you are? And then, of course, now we're dealing with this, still dealing. I mean, obviously the last couple of months have been particularly intense, but we're still dealing with this COVID-19 pandemic. Have you guys been providing service all along? And how have you navigated the COVID-19 landscape?
It is a challenging time because very early, you remember I think by March, the government started jumping in, the state governments would have this mandate. But I think URMC, we implemented many measures and the protocols in a very short period of time. So this is across all our institutions, different clinics. So we implement all those measures. For example, so universal masking. We have all the patients come in will have mask. We as the providers, we also wear masks. We have not returned any patient down. We continue to treat during this pandemic area. It's kind of challenging but doable. So screening, for example. So all the patients come into our door, they have somebody to screen them, ask them histories to make sure they do not have any symptoms of COVID-19, any cough, fevers.
Mm-hmm. So So you never closed, is what I'm hearing. You've been serving patients all along,
right.
And now you've got protocols in place to help protect patients and obviously the faculty and the staff. So
we're lucky that we do not have any patient that get infected here, and we
lucky.
We have to screen ourselves, our employees every day.
Mm-hmm. That's fantastic news that none of your patients are infected and none became infected, especially because I imagine that somebody who's already struggling with cancer, would really have a tough time having to deal with COVID-19 on top of it. So thank goodness. Yeah, that's fantastic. A testament also to how clean you've kept everything. So as you move forward, how do people reach out to you? The same way they always did? Are there different ways that different things they need to be thinking about? Or can they just pick up the phone and make an appointment like they always did? And how do they do that, by the way?
Oh, yeah. So we do not have a call center. So anybody pick up the phone, we actually keep the same phone number from our old location. So the same phone number you call us is directed to our front desk.
Terrific.
So you can make an appointment directly. We can reach to nurse, can reach me, reach my assistant. So the whole team is the same team here in serving the community for many years.
That's great. And I'm sure they can also Google Wilmot Cancer Institute, Wilmot Cancer Center at Greece, and anybody. And you're also members of the Greece Regional Chamber of Commerce, so you can also go to the Greece Chamber website, greecechamber.org. Many ways to find the Wilmot Cancer Institute, Wilmot Cancer Center at Greece. We're so grateful that you're in the Greece community, the general community as well, in doing the important work that you're doing. And great to know that you've been able to move forward through this difficult time, that it hasn't stopped you from being able to serve patients, and that your patients have come through this very well, it sounds like, which is fantastic. And we really appreciate your coming on Business Voice. Thank you.
All right. Thank you for having me.
Oh, you're very welcome. Dr. Ben Liu of the Wilmot Cancer Institute. Thank you so much for being on Business Voice again. And now on the line, I have Dr. Alex Solky, also from the Wilmot Cancer Center, Wilmot Cancer Institute at Greece, who's going to be talking with us a little bit about the role that he plays. Welcome, Dr. Solky.
Oh, thanks so much for having me.
Oh, absolutely. So we talked just a minute ago with Dr. Liu and got a bit of an overview of the Wilmot Cancer Institute, and I'm understanding better now that it's one of the satellite offices, essentially, of the Wilmot Cancer Center at Strong, which is, of course, a really important institution in our community. And you are a medical oncologist?
I am.
So I think I know what that means, but maybe I don't. So, and maybe people listening wouldn't mind getting a little bit of a sense of what that means.
Sure. So many people who are diagnosed with cancer will meet three different kinds of oncologists. It obviously depends on what kind of cancer, but You potentially meet a surgical oncologist, someone who would operate if, say, you had a breast cancer that needed to be taken out. You meet a radiation oncologist, and you just talked to Ben Liu. And both the surgical and the radiation oncologist, their job is to deal with the cancer where it's seen.
I see.
Right? And so they either cut it out or radiate around an area. The medical oncologist, we give chemotherapy, immunotherapy, anti-hormonal therapy, which is geared towards treating the cancer either where you see it, and if unfortunately it's already spread out, and also where it might be hiding and too small to ever be seen. So again, I give medications either by mouth or in a vein to try and fight cancers wherever they may be in the body.
Wow. So that's probably evolved quite a bit in the last decade. Is that correct?
Yes, absolutely. So I've been doing medical oncology since 1999.
Oh, wow.
And I've seen it change tremendously. You know, the number of treatment options that we have for different diseases and the manner in which we treat them. You know, many people have probably heard commercials for medications like Keytruda or Opdivo on the TV, and those medicines are actually harnessing your body's own immune system to rev up and fight the cancer. Not everybody can use those kinds of medications, and they're not good in every kind of cancer, so we still use traditional chemotherapy, although the medications that we have to decrease side effects of the chemotherapies that many people know from the past are so much better than they were in the past.
That's great news, because I do think that there's still an image of radiation and chemotherapy as being incredibly difficult to go through. And it's really good to hear that we have additional options, but also, if I'm understanding correctly, some perhaps additional level of precision so that we don't have to hammer somebody maybe quite so hard with those two, with radiation and chemotherapy, because we can be we have a little more finesse, a little more sophistication. That sound about right?
I think we have a lot more sophistication,
Good.
and it doesn't mean that it's not hard to go through things. It doesn't mean that people won't have side effects. But even when you think about anti-hormonal therapy for breast cancer, drugs that have been around for decades, like tamoxifen, that's already sort of a smart bomb technology, right? Where you're focusing on blocking just the estrogen receptor. And so that's been around for a long time. But now we have many more medicines and understand a lot more of the targets that we're trying to attack in people's cancers. So for some people, we have, some people who have spread out lung cancer, for example, have medicines that they can take by mouth, which fight the cancers incredibly well and are relatively tolerable. Any person taking any medicine can have bad side effects or less bad side effects, but we are much better at taking care of people in all the different ways that is important.
That's really good news. That's a very hopeful message, and I imagine that we're going to get better and better. If we've gotten better over the last decade, then surely we'll be getting even better still, so that patients will be dealing with less discomfort and more easing of the difficulty of the disease.
Absolutely.
So that's wonderful news. Yeah.
Our goal is to help people. If you have an incurable cancer, we want you to live longer and feel better during whatever time you have, and we're able to do both of those things so much better than 21 years ago when I started in oncology. And so it makes me very hopeful for the people who come in my door.
Yeah. Oh, that's great. It sounds as though you find a lot of meaning in your work, and I imagine that it's difficult work, especially if you care about people. This has got to be difficult work, but I also can hear why you do it, because if you're able to make somebody feel better, live longer, that's a pretty meaningful occupation, isn't it?
It is, and we have in my family one of the bad breast and ovarian cancer genes. My grandmother had both breast and ovarian cancer. You know, I've had many people who've gone through horrible cancers, including my aunt, who had a brain tumor, and my young cousin, when I was in high school, she was in her 20s, and she had metastatic breast cancer everywhere.
Oh, my goodness. I'm so sorry.
No, that's okay. I mean, you know, we all go through things in life, but it drove me to say, look, not only do you have to be a scientist, but you have to be a compassionate scientist, so that you can use the information, but also, you know, help people to deal with the difficult decisions they have to make, and try and make their lives better. And it's a privilege to be able to do it. But you're right, it is hard. Yeah. But you know, that's why we still do other things to take care of ourselves, right?
Yeah. Yeah. I think we're very lucky, after having talked with you and Dr. Liu, we're very, very lucky to have you in the community, and especially lucky to have you, because you also, are seeing patients at the Greece location of the Wilmot Cancer Center, right?
Absolutely. So I've actually been doing oncology in Greece for my entire attending career.
Oh, wow.
So I finished internal medicine training at the University of Rochester in 1999, and then started the specialized training in oncology for 2 years. And in 2001, I joined Interlake's Oncology, and the office I practiced in most since 2001 has been an office in Greece. You know, we were on campus at Unity for a while, and just recently moved into this wonderful new facility, you know, on Bellwood. It's amazing, actually.
Well, I haven't seen it yet. I'm looking forward to it. I think that's part of the plan. I think COVID-19 kind of derailed that plan, but eventually I'm looking forward to coming and seeing the facility. And importantly, anybody who needs your services is able to come to the facility and to make an appointment with you guys. You are not closed. You are actively working, and you are keeping everything as safe and clean as possible. I heard that very clearly from Dr. Liu. So it's a pleasure to meet you, Dr. Alex Solky, medical oncologist at the Wilmot Cancer Institute, the Wilmot Cancer Center at Greece. Thank you so much for joining us here today on Business Voice.
It's an absolute pleasure, and we've loved being here in Greece. And Interlake's and our affiliation with Wilmot has been going on for the last 7 years, and I'll tell you, it's done nothing but excellent things for our patients out here in Greece to have Wilmot be a partner with us. That's
great. That's great news. We hope that you come back and give us an update in the coming months. Will you promise to do that?
Of course, anytime. And you know, I'm glad that Ben Liu talked about the things that we're doing at the center to make people safe. You know, we've stayed open. We do things like Zoom visits to make sure, you know, there aren't too many people in the office at any one time. Given our much bigger facility than we had actually on the Unity campus, we can do social distancing and spacing and still get our patients treated. So this has been a godsend that it happened right when it did.
That's great. Thank you again for coming on, and we look forward to having you back. Bye-bye.
Anytime. Take care.
Thank you. That just about wraps it up for us here today on Business Voice. I'm Sarah Lentini, President and CEO of the Greece Regional Chamber of Commerce. And I want to thank all of my guests here today, starting with Anis Osmic of M&T Bank, Dr. Stamatia Destounis of Elizabeth Wende Breast Care, Dr. Ben Liu, and Dr. Alex Solky of the Wilmot Cancer Center at Greece. Wonderful, wonderful guests, lots of great information, and lots of hopeful news, which we could all use right now. And I also want to thank, of course, our presenting sponsor, Bartolomeo and Perotto Funeral Home. We couldn't do the show without them. Thank you. And thank all of you for joining us and listening, and we hope that you tune in again for next month's edition of Business Voice.
You've been listening to Business Voice. The Greece Regional Chamber of Commerce serves businesses, nonprofits, and individuals throughout the region, focusing on promoting economic and community development and serving as the voice for business. The Chamber offers networking, education, advocacy, community events, and business services. It serves as an important platform for business leaders and citizens to come together in support of common goals.